Hello, in this video I am going to discuss about the blood vessels of neck, head, neck and face part 2. That is, in part 1 we have seen the arteries related to head, neck and face, and in part 2 we will see the veins related. So, veins of head, neck and face. So, major veins that are present in the head, neck and face, you can see in this picture. Here it is the left subclavian vein, left internal jugular vein, left brachiocephalic vein, and this is of right side, right internal jugular, right subclavian, both draining into superior vena cava, and you all know that where superior vena cava drains, that is in the right atrium. Okay. So in this lecture, we will deal mainly with the internal jugular vein, external jugular vein, subclavian vein, brachiocephalic vein, veins of the scalp, veins of the orbit, veins of the nose, and veins of the infratemporal region. Upper four are main veins related to HNF. Now, to start with internal jugular vein. It receives blood from brain, face, and the neck region. Mainly, it emerges through the jugular foramen as a continuation of the sigmoid sinus and descends down in the neck. First it is behind, then lateral to internal carotid artery inside the carotid sheath. This carotid sheath is again one important thing. So, how it is related to internal carotid artery in the carotid sheath? It is first behind and then lateral to internal carotid artery. You can see here it is the right sigmoid sinus and here it is the left one. It is passing through the jugular foramen. So this is the jugular foramen and here it is going down, and this part is related to the carotid sheath. Superior and inferior bulbs are dilatation near the origin and termination of the vein. You can see here the superior bulb and here it is the inferior bulb. So two bulbs are there. So what we have seen in this, it is the continuation of the sigmoid sinus, and after emerging through the jugular foramen, the sigmoid sinus will continue as internal jugular vein. Now, the relations of internal jugular vein. We can see in this diagram the superficial relation. Internal jugular vein is crossed by two muscles. One is posterior belly of digastric in the upper part. Another one is inferior belly of omohyoid in the lower part. Here, this one is the posterior belly of digastric and it is the superior belly of omohyoid. Two arteries, occipital artery, posterior auricular artery. Posterior auricular artery and then the occipital artery. One vein, anterior jugular vein. This one is the anterior jugular vein. Two nerves, spinal accessory nerve and inferior root of ansa cervicalis. This is the inferior root of ansa cervicalis, and this one is the spinal accessory nerve. At the base of skull, the internal carotid artery lies in front of the internal jugular vein, and the last four cranial nerves intervenes between the vein and the artery. Medial relations are internal carotid artery and 9th, 10th, 11th and 12th cranial nerve in the upper part, common carotid artery and vagus nerve in the lower part. Posterior relation are from above downwards, rectus capatis lateralis, this one is the rectus capatis lateralis, transverse process of atlas, levator scapulae, scalenus medius, this one is the scalenus medius, scalenus anterior and phrenic nerve, scalenus anterior and the phrenic nerve, thyrocervical trunk and first part of vertebral artery, first part of subclavian artery, this one is the first part of subclavian artery, thoracic duct on the left side and the sternocleidomastoid. So this diagram is self-explanatory. Here the internal jugular vein is cut, so we can see the deeper structure from above downwards. What are the tributaries of internal jugular vein? Inferior pectoral sinus, pharyngeal vein, common facial vein, lingual vein, superior thyroid vein, middle thyroid vein, sometimes occipital vein. So MCQ question can be asked that about any of the tributaries. So one again thing is that superficial cerebral veins, it is to drain into the right internal jugular vein after passing through superior sagittal sinus, right transverse, and then the sigmoid sinus. This is the special observation. And the deep cerebral vein via great cerebral vein of Galen and straight sinus to the sigmoid sinus will drain into the left internal jugular vein. So the superficial cerebral vein will drain into the right one and deep cerebral vein will drain into the left one. This is about the parotid. So in the parotid, we will see the retromandibular and external jugular vein. And these are the venous drainage of the thyroid gland. You can see superior thyroid vein draining into the internal jugular and the middle thyroid vein and then the inferior thyroid vein, one again additional Kocher's vein. Here you can see the inferior thyroid vein is draining into the left brachiocephalic. Now we will see the external jugular vein. This is formed near the angle of mandible below the parotid gland by the union of posterior division of retromandibular vein and the posterior auricular vein. And superficial fascia and separated from sternocleidomastoid by deep cervical fascia. After that, it pierces the deep cervical fascia at anteroinferior angle of posterior triangle 2.5 cm above the clavicle and enter the supraclavicular space and drain into the subclavian vein. So, MCQ question, external jugular vein will drain into the subclavian vein. You can see here about the external jugular vein, right? Posterior auricular vein joining with the posterior division of the retromandibular vein joins and forms the external jugular vein, and it is draining into the subclavian vein. What are the tributaries of the external jugular vein? It is the suprascapular vein, transverse cervical vein, and the posterior external jugular vein, anterior jugular vein. So in this you can see the right external jugular vein is draining into the right subclavian, and left external jugular vein draining into the left one. Okay, and when both the subclavian vein after joining with the, that is the internal jugular vein, they will form the brachiocephalic vein, and both side brachiocephalic will join and drain into the superior vena cava. Now about the subclavian vein. So we have already seen that subclavian vein is a continuation of the axillary vein and runs from the outer border of the first rib to the medial border of the scalenus anterior muscle. From here, it joins the internal jugular vein to form the brachiocephalic vein, also known as innominate vein. The thoracic duct drains the left subclavian vein near its junction with the left internal jugular vein. It is often served as a route for central venous access in patients on critical care, that is in emergency cases, so that central venous line can be established. Subclavian vein is used. About the relations of the subclavian vein, in front the clavicle is related and the subclavius muscle. Behind, subclavian artery with intervening scalenus anterior muscle and phrenic nerve. Below, first rib and cupula of pleura. So I want to tell you that if you will see the first rib, there is one tubercle is there for scalenus anterior. So anterior relation will be for subclavian artery and posterior relation is for subclavian. Anteriorly with the subclavian vein is there and posteriorly subclavian artery is there intervening with the scalenus anterior muscle. Tributaries of subclavian vein: external jugular vein, dorsal scapular vein, thoracic duct on left side and right lymphatic duct on right side. Anterior jugular vein, okay, and sometimes cephalic vein. So these 4 and 5 number is occasionally they drain into the subclavian vein. Brachiocephalic vein, both side, the left and right brachiocephalic in the upper chest is formed by the union of the each corresponding internal jugular and subclavian vein. This is formed at the level of the sternoclavicular joint. Left brachiocephalic vein is shorter, about 6 cm, and it is the right one that is of 2.5 cm. So the right one is shorter than the left brachiocephalic vein. This vein merges to form the superior vena cava, a great vessel posterior to the junction of the first costal cartilage with the manubrium sterni. Brachiocephalic veins are the major vein returning blood to the superior vena cava. You can see in the picture subclavian, internal jugular, forming the brachiocephalic, draining into the superior vena cava. Okay, so in this all the tributaries of the internal jugular and the subclavian veins are seen. Brachiocephalic vein, it is also seen that which vein drain into the brachiocephalic. Vertebral vein, internal thoracic and the first, second and third posterior intercostal vein. So these vein and the inferior thyroid vein will drain into the brachiocephalic. So about the, you can see here that in internal jugular vein two communication are there. One is with the external jugular vein and another is with the cavernous sinus through the inferior petrosal sinus. The brachiocephalic vein is formed by the confluence of the subclavian and internal jugular vein. In addition, it receives drainage from, or we have already seen in the diagram, left and right internal thoracic vein, left and right inferior thyroid vein, and vertebral vein, superior intercostal vein. So these are the veins that will drain into the brachiocephalic. So about the emissary vein and diploic vein. In the skull, there are emissary vein and diploic veins. So what are the emissary vein of skull? Emissary veins are veins that will connect the extracranial veins with the intracranial venous sinuses. So because of this only the fourth layer, that is known as the dangerous layer of skull, because through this any infection in the face also outside the skull that can transfer to the inside. So some of the emissary veins are parietal emissary vein. It will pass through the parietal foramina and connect the veins of the skull to the superior sagittal sinus, as mastoid emissary vein will pass through the mastoid foramina, connects the veins of the scalp with the sigmoid sinus. So if you will recollect the position of these emissary vein, you can gather that it can connect to which sinuses, okay, and with which vein. So one of the emissary vein passes through the hypoglossal canal and it will connect the internal jugular vein with the sigmoid sinus. Condylar emissary vein will connect through the suboccipital venous plexus to the sigmoid sinus. Okay, some emissary vein will pass through the foramen lacerum, that is connecting the pharyngeal plexus to the cavernous sinus. As another veins that will pass to the ovale and cecum, it will connect to the pterygoid venous plexus to the cavernous sinus, and veins of the nose to the superior sagittal sinus. Diploic veins. Diploic vein which are present in frontal, that will drain into supraorbital vein, in parietal, that is draining into sphenoparietal sinus, posterior temporal vein drain into the transverse sinus, occipital diploic vein to the suboccipital venous plexus through occipital vein. So these are veins that are present in diploe of the skull. So this area is referred to as dangerous area of face because the facial vein, you can see that how it connects to the cavernous sinus, joining with the deep facial vein and through pterygoid venous plexus, it will connect through the cavernous sinus via emissary vein. So this area is, any infection in this area can infect the cavernous sinus. So here you can see that this is the cavernous sinus, okay, and here is the facial vein, okay, facial vein that it is connecting through the pterygoid plexus to the cavernous sinus, okay. What are the veins in the orbit? Except the supratrochlear and supraorbital vein will correspond to the branches of the ophthalmic artery. Superior ophthalmic vein, anteriorly it will communicate with facial vein, and posteriorly it passes through the superior orbital fissure and ends in the cavernous sinus. Okay, through inferior ophthalmic vein also disconnecting the cavernous sinus is connecting. Okay, central vein of retina is also draining into cavernous sinus. So all these veins that are present in the orbit, they are very much prone to infect the inside of the skull. About the veins of the nose, internal nasal vein joined to form the sphenopalatine vein that ends in the pterygoid plexus. Superior labial and external nasal vein pass to the facial vein. You can see in the diagram. Okay, this is the angular vein. Okay, that is the supraorbital and supratrochlear. Ultimately, this is here that is draining into the superior ophthalmic that we have already seen. Okay, that this angular is draining into the facial vein. Okay, and you can see here the inferior ophthalmic and superior ophthalmic. Okay, that is connecting with the cavernous sinus. Now, the pterygoid plexus of vein. Question can be asked that where it is present. A network of very small veins lie around and within the lateral pterygoid muscle in the infratemporal region. Okay, receive some of the veins that correspond to maxillary artery, inferior ophthalmic vein, and deep vein. So sometimes the lateral pterygoid muscle is named as peripheral heart. The facial vein connects the cavernous sinus. Here is the facial vein. Okay, pterygoid venous plexus, and they are connecting through the emissary vein. So infection of the face can cause thrombosis of the cavernous sinus. Lacrimal gland drains into ophthalmic and facial vein. Okay, the tributaries of the plexus correspond to the branches of the maxillary artery. The pterygoid plexus is drained by maxillary vein, which begins at the posterior end of the plexus, unites with the superficial temporal vein to form the retromandibular vein. Now, suboccipital plexus of vein. It lies in and around the suboccipital triangle. It will connect the following vein: muscular vein of the neighboring sixth muscle, occipital vein, internal vertebral venous plexus, condylar emissary vein from sigmoid sinus, deep cervical vein, and the plexus around the vertebral artery. Okay, it will provide alternate route for the venous drainage. You can see here it is the suboccipital venous plexus that is going down and around the vertebral artery, and lastly it will drain into the vertebral vein. Okay, here it is the posterior jugular vein. Here again you can see how the sigmoid sinus, okay, sigmoid sinus, and here from the superior petrosal and inferior petrosal, okay, then it will go down and continues at the internal jugular vein. Okay, so here you will see the occipital sinus, they both are forming the vertebral venous plexus, ultimately draining into the vertebral vein. Here you can see the deep cervical vein, anterior condylar vein, and the basilar venous plexus. This is the internal jugular vein along with the subclavian vein forming the brachiocephalic vein and showing the all the tributaries of the internal jugular vein. So that is about the main points about the venous drainage related to the head and neck region. So I hope you have seen all the things. You can see here external jugular, more medially is the internal jugular, okay, and then this one is forming with the subclavian and then forming the brachiocephalic, okay. So now some of the applied aspects related to the venous drainage of the head, neck and face. We have seen some of them. Further, internal jugular veins serve as a guide for removal of the lymph node and infection from middle ear, just as otitis media can be also travels to the internal jugular vein because the floor of the middle ear cavity is related to internal jugular vein, and also infection from the throat through the auditory tube can pass to the internal jugular vein. So it can be ligated in this case. For central venous line, also internal jugular vein can be used. So cannulation, the needle is inserted at the apex of lesser supraclavicular fossa and it is directed backward and upward to avoid injury to cervical pleura, and because if injury is there, it can lead to pneumothorax. Okay, so in the regarding the external jugular vein, it is adherent to the fascia around. So if it is cut and during the surgery the deep fascia is not cut, so air embolism can result. The jugular vein can be served as a venous manometer. Okay, so in this it is that sometimes it is referred to as internal barometer of the body. When the patient lies flat, the vein is at the same level of the right atrium and entire vein is full of blood. So when the head rests on a pillow or near the 45-degree angle, so the vein becomes empty. So if it does not empty, it is told that block is maybe there. So for the subclavian vein catheterization can be used for central venous line. Subclavian vein thrombosis can also be result in the infection. Subclavian vein catheterization, supraclavicular and infraclavicular approach is taken. In the infraclavicular approach, the needle is inserted just below the lower border of clavicle at the junction of medial 1/3 and lateral 2/3. And in supraclavicular, it is inserted at the junction of lateral border of clavicular head of the sternocleidomastoid and upper border of the clavicle. So what about the weekend deaths test? That is, in normal condition, the rate of flow of CSF is increased during lumbar puncture when both the internal jugular vein are compressed due to backflow. So this is called as Kukender's test. If there is block in spinal subarachnoid space, the pressure will not rise when the internal jugular vein are compressed. So this is all about the venous drainage of the head, neck and face. Thank you.